Michael Betel, President and founder of the Fatty Liver Alliance. We raise awareness about the risk, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Our special guest today is Dr. Kassouf Maalouf, VP of the International Diabetes Federation and founder and president of DiaLeb, the National Diabetes Organization in Lebanon. Jackie, we see the stats and we recognize that the incidence of type 2 diabetes is heading in the wrong direction. That's with obesity and MASLD and MASH on the liver side, and they're all metabolic comorbidities. What is DiaLeb focusing on? And with all the awareness and all the tools available, why do you think things are still going in the wrong direction and looking so dire now?
First of all, Mike, thank you for having me. It's very important to have this holistic approach and showing that, yes, the NCDs are interrelated and interconnected, such is the case between diabetes and liver diseases. And as you mentioned, we don't want to be pessimistic, but yes, the numbers are showing us that we're not in the right direction, despite all the efforts that I have to acknowledge we as International Diabetes Federation and as member associations across the globe are doing great efforts. And yet there is a lot to be done. As for us in Lebanon, as DiaLeb, we have several programs. We believe that only through awareness we can limit the increase in numbers. Yes, we know diabetes is not reversible, but we can limit the increase of it. We can tackle the huge number of people in the this like shady place called pre-diabetes. And if we raise the level of awareness to this community that we consider at very high risk, since if we don't do anything at this point, they will definitely be people living with diabetes and in no time. So if we focus more on raising the level of awareness, explaining all the risks and all the complications that we don't want to see happening, then through that, maybe we can do something. And that's why we have a program for schools, diabetes in schools and in universities. And we have a program called Diabetes in the Community, where we collaborate with municipalities across Lebanon. We have many programs that we do online. We are far from considering ourselves global, but we like to consider that our reach and our impact crosses by far the frontiers of Lebanon and the borders of Lebanon. So we do many things online, and we do it English and Arabic. And with that, I think we can reach a lot of people, whether living with diabetes or other NCDs, or at risk to becoming maybe tomorrow, maybe in 5 years, a patient of one of the diseases related to diabetes or any other of the non-communicable diseases. So I do believe our weapon to counter-arrest this tsunami of diabetes and people living with other NCDs is knowledge, is awareness, is education. So if we work on prevention rather than medication, I think we would be in no time headed in the right direction and seeing at least a reduction, in the prevalence of diabetes.
So a couple things come to mind, and thank you for that. And I agree with you. If people are unaware, that's a really big issue. We have to identify people early too, so that they know who's at risk, and the A1C test is really important. One of the things that really bothers me personally is that there are so many tools available, like the continuous glucose monitors, like different weight loss drugs, the GLP-1s, and none of them are approved for patients who have prediabetes. And so in the thought of possibly preventing the transition between the prediabetes and type 2 diabetes, people have to do it on their own, and it goes back to lifestyle management for the most part, right?
I want to say here that sometimes people tend to neglect their health a little bit. But if we know that diabetes is a silent killer, is known to be a silent killer, We understand that it can be there for 5, 10, 15 years. And if the people are not aware, if they're not doing their regular tests, if they're not attending any of our awareness campaigns, our awareness events where we do screening campaigns, we do the HbA1c test, we do the simple finger prick just to call attention on the importance of early diagnosis, just like any other disease. Be it diabetes, be it liver diseases, or whatever it is, or cardiovascular disease, or kidney disease. When you have early detection, when you're aware enough to test yourself regularly, you can do a lot more to avoid at least complications. If you cannot avoid the disease itself, you will avoid a lot of the unpleasant, to say the least, complications.
You also said something that struck me, that I don't think you used the word chronic, but that these diseases don't have cures. You said incurable earlier on
I
in our
said it's
conversation.
not reversible.
Reversible. So,
Yeah.
but I think that if people recognize that type 2 diabetes and obesity and MASLD and MASH, they're all chronic diseases that I think we have to recognize that if your physician chooses to put you on a medication, that it's not a short-term fix, that you might bring it under, hopefully under control, but this is something you're going to have to continue to take. It's not like, oh, I can do it for like a year and then I'm good, right?
Mike, it's indeed, if it's not reversible, it is indeed preventable. And
Right.
this is the key. People need to know, if I have diabetes in my family, yes, I'm more at risk, but not necessarily I should become a person living with diabetes. There are ways to prevent, and there comes the modifiable risk factors that we always talk about. You can't do anything about your age, which is a risk factor. You can't do anything about your family history, which is another risk factor, but you can do a lot about your weight. You can manage your weight, and this is a risk factor. You can do a lot about smoking cessation if you are a smoker, or never smoking if you're not a smoker, because that's another risk factor. You can watch your nutrition habits. You can do more sports activities, physical activities. We don't need to be champions. We're not calling on people to run a marathon every day. No, we just want simple little things. Don't take the elevator if you're going to the second floor. Don't park your car at the door of the mall. Park it a little bit farther. Do some walking. Take some vitamin D from the sun. Sometimes very little things can help us do major lifestyle changes. And guess what? The impact, the outcome, they are amazing. Little changes sometimes can really benefit our health more than we can ever imagine. If we lose, let's say, 5% of our weight, if I'm a person with a little bit overweight, if I lose 5% of my weight, which is nothing really, not major, and if we do it properly through proper nutrition, minding what we are eating, the quality of the food we are eating, this has a tremendous impact even on those people who already have diabetes. If they lose 5% of their weight, it means 1 point less in the HbA1c. This is huge.
Yeah.
When you think of the benefits of it. So we tend to insist a lot on, we hear a lot lately about lifestyle changes and how important lifestyle is. And we hear more even about the QOL, the quality of life. We don't want simply to live. We want to live healthy, happy, enjoy time with our family. In order for us to do that, we need to pay attention to our health. We need to be active physically, not sit all day. If we have to at work, if we must to, then that's fine. But outside work, let's be active. Let's walk our dogs. Let's take our children or our nephews or our grandchildren for a walk to the park. Let's do a little hiking. This is what we preach, and we do it. We lead by example. We have our small community of people with type 1 diabetes. We organize hikes with them. We do a bike-a-thon. We do a mini marathon. We do walks. when we invite them, it's not to eat, it's to do yoga, open air, a session of yoga. It's to do meditation. Sometimes we do that also with our groups of type 2 with a big challenge. And I'm sure it's not in Lebanon, it's not in Canada, it's not in the US, it's all over. With people living with type 2 diabetes, we have a major challenge, which is denial. We get it throughout our screening campaigns. You get someone having the HbA1c, for example, 7.5. And we ask very nicely, so are you a person living with diabetes? No, I don't have diabetes. 5 years ago, I visited my physician. He gave me some pills, and then I felt very well after that. That's why what we do is very much needed. Even in, I travel a lot and I go periodically to the US and so on. I've attended events where exactly the same challenges we face here, they face in the US. And I'm sure you face the same in Canada as well. So challenges exist, but we have to work around them.
By the way, speaking of challenges and conferences, as you said, because I've seen you at a few, they need to have healthier food options at the conferences that we go to as well.
Absolutely.
Let's set the example. So anyone listening to this who's setting up
not an ice cream stand, not sandwiches full of carbs. I mean,
yes,
absolutely right.
Otherwise, Jackie's coming after you. Thank you.
And Mike too. And by the way, it was really a pleasure to meet you over these last events that we happen to be, whether in Geneva or in Milan. And it's always enriching to exchange expertise, to know from you what is happening in your country with your activities, and to tell you what we are doing on the other side of the world, across the globe. It's always enriching.
And so, Jackie, thank you for sharing so many insights and suggestions and ideas. And there's a lot to listen to here. And thank you for spending time with us today. And we will definitely be keeping in touch and seeing you at future meetings. So thanks very, very much.
Thank you, Mike. I admire what you do. I wish you all the best. You're doing a great job for the people living with liver diseases. And I'm sure by uniting effort, by joining hand in hand, we can give the best holistic approach to all these diseases and probably change the wrong direction you mentioned at the beginning of this talk. Thank you so much for having me. And I hope the people who will listen to this will really take a moment to think about their health.
Totally agree.
Thank you.
Thanks.